Hi, Dr. Stevenson. So we are group 7. This is our ethics video. My name is Kylee Homello.
My name is Zavala.
I'm David Taves.
I'm Robert Denslow.
And I'm Sarah Ladhani. And I will be going over the prompt. It is fall semester of your third year of WesternU CDM. You're enjoying the challenges of patient treatment in clinic, but your patient pool has been loaded with perio patients and you are tired of perio exams and SRPs. You also have a denture patient, but that has been rough. Others in your group always seem to be assisting because their patients keep canceling. Today, you are on screening rotation. Your managing partner has instructed you to contact her regarding assignments of patients because some in your group still do not have good patients. Your first screening patient seems to be ideal for a student clinic. As you examine her, she seems to need enough restorative work to keep you occupied well into your fourth year. You know your MP will assign the student someone else in your group, but you really want this patient.
So what are the facts of this case?
So the main facts that we should try to focus on is that we're the third year student at Western. The majority of our cases have been perio patients and SRPs. We also have a denture patient. And we're looking to expand our horizons a little bit. We want some restorative appointments, but we haven't gotten those yet. We also know that we got a screening rotation today, and a patient that we screened is perfect for us. However, we know that people in our group don't have patients at all. So another fact is that our MP is probably going to give this patient to someone else to give them appointment times. So that's where the dilemma starts. Who is affected in this dilemma is us as the student. We want the case, but we probably won't get it. Who else is affected? Our classmates, because they are the ones that could potentially have this new patient. Someone else who is also affected is the managing partner, because they will have the task of deciding who this patient goes to and having that conversation with us after the screening has been completed. And then the patient's also affected in this dilemma because it depends on who's giving them the right care. So that's kind of where the dilemma stems from.
Okay, so now we're going to identify the ethical principles involved.
So I understand this student's frustration of just getting perio and SRP and not getting much other experience, but it is unfair to claim a patient for yourself while your classmates don't, like, they're just assisting. They don't even have patients to see in general.
Yeah, I would agree. I definitely feel that having a lack of a variety of experiences, as a practicing dentist, is a requirement, when you're in dental school. So I can see where the student is coming from, where he or she has the power to kind of just give himself or herself this patient. And I can see how this, it's a position where you want that experience and you don't really want to take the risk of giving it to somebody else. And that's a situation that I feel like could, have some ethical issues, because you're essentially going and making a decision without the authoritative, I guess, approval of your MP. I think
There's a degree of beneficence that you should be able to exercise to help, not only yourself in terms of giving to your classmates, but just being patient, and you'll eventually have the restorative patients you'll need.
agreed. Okay.
Yeah, and I think also just being able to, I think it'd be best if the student communicates with an MP so that they understand what the issue is, and then maybe they can both come up with a solution, and so that all parties are pretty much satisfied. And that also stems from the do no harm ethical principle, so that no one is negatively affected and everyone can have some sort of win in this case.
Agreed. Thank you. The next point here is that we have to identify the rational options that would help resolve this dilemma. So I would say primarily, we can go ahead and have the patient care coordinator schedule the patient themselves, and that would essentially remove the issue of us scheduling them for ourselves, which could be seen as unethical, being one point that we could be bringing up.
Yeah, and then the other one is reporting to the MP as instructed. And then lastly, like we talked about, going to the MP and explaining the situation.
Agreed.
Yeah. Oh, no, keep going.
Got it. So the next slide here, we're going to be saying that you want to choose an option that would resolve this dilemma, right? Because we don't really want the student dealing with this, or anyone for that matter. And the dilemma, the option that we're electing to go with would be to go to your MP and explain the situation. That would allow the MP to make the decision, maybe give you some advice or inform you of why you could or could not have the patient, or why it might be better suited for a different student that may not be you, or maybe you are the lucky student that gets to have that patient in the end. But definitely going with that MP would be the best alternative.
Yeah,
Yeah.
I think communication is definitely key here, and key most of the time. Usually when there's miscommunication, that's where somebody gets negatively affected. So that's probably the best thing to do.
Yeah, I think so too.
I think that it's a good idea to follow protocol and potentially go to the MP faculty as directed, but not all these situations are really cut and dry. So sometimes explaining the situation from your perspective and letting the faculty, since they are the ones, essentially they are the licensed providers, make the ultimate decision. It frees yourself of having to have any bias involved.
that's a
Exactly.
good
I think it's just
point.
having that conversation with the MP just to kind of explain your side. So then you're also not paranoid about yourself scheduling the patient for yourself. I'm like, oh, I didn't ask the MP. Like, is that fine? Will they notice that I did that? So I think it's just starting to have that conversation initially to know, so the MP knows where you're coming from. Because you also have to have restorative cases to graduate. You need to have those requirements, but so do the other classmates. So it's just that it's trying to find that balance. I think is okay, maybe if I don't get this one, the next person who does the screening, maybe I'll get that restorative case. So just having that conversation with the MP and kind of, because they know more of what your classmates need as well. So they're trying to help balance it too. So it's just trying to find that common ground for your whole group and not just yourself.
That's a good point, Bobby, about the faculty have a better finger on the pulse on what the whole group needs versus just what you specifically need.
Yeah.
Right.
I just wanted to piggyback on what David was kind of emphasizing, that I agree with you, Bobby, as well, on the MP just having kind of a, some behind the scenes stuff that you may not be aware of.
So reflecting on the impact of the decision. So I think we kind of talked about that. Just how if we were able to talk to our MP, they would know more about the general group and who would need that case and what they can do for you as well. And then I think the last question was, how would you feel as a managing partner if you knew a student was making a decision without consulting you? I think I would be upset if a student didn't consult with me. I feel like if there's not that open communication, you don't know what else they're deciding. And at the end of the day, they are practicing under your license. So I feel like as an MP, you would want to be able to trust your students and have that open communication with them.
Yeah, I completely agree, Kylie. And I feel that not only would it affect the dynamic you have within the school, but moving forward, this might affect your professional opinion of how they handle themselves, once they actually become a dentist, and how they handle decisions to be made with their colleagues, with their coworkers, in this professional environment, since now how they handle themselves.
Yeah. Well, I think that is good. Thank you so much for discussing this case with us, and I hope everyone has a great day.
Thank you.